Good morning to you all. Can you all hear me at the back all right? I'm Ros Jervis, Director of Public Health, and I've literally been in post just a few weeks. So I can't tell you how pleased I am to be here, to be given the opportunity to talk to so many people so early on in my time at Hywel. So I'm really here to say hello, introduce myself to you all, and hopefully share just a few of my thoughts around the plans that I've got in terms of improving health across Hywel, and a little bit about myself, and hopefully how you can help me in terms of putting together my plans for the future, but also for some of those things that are on my worry list at the moment. So I've literally been here a few weeks. I've come from the West Midlands, from Wolverhampton in the West Midlands. So I've gone from an area that's 7 by 8 miles with a very densely populated area with some very, very significant health challenges in very deprived wards. Most of the wards across Wolverhampton are very deprived, to an area of absolute outstanding natural beauty where actually I have a long way to travel to get from one side to the other. Now, some of the challenges that we face are the same in terms of some of those health outcomes that I want to improve, but some of them are very different. And that rurality of my new patch, so to speak, is actually bringing some things that I really need to approach in a very different way. And actually, I'm here to ask for your help in order for me to do that. And I mean absolutely everybody's help. So I started off my professional career back in the early 90s as an environmental health officer. So I was one of those health inspectors with the white hat that you've all seen on the television and The Life of Grime, going into restaurants and businesses, probably giving them all terrible times. But it gave me a really good grounding in terms of supporting people, protecting their health. But I kept on coming back to the fact that I wanted to do this on a bigger scale. So I was really fortunate enough to get onto a very small training scheme with a very competitive in terms of places, a medical specialty training scheme in the West Midlands to train as a public health practitioner. And I had 5 fantastic years in that training, so I was really privileged to get on that training scheme and came out of that getting a consultant position at a primary care trust in England, in Wolverhampton. And that was really, again, my start of understanding health within a very deprived community in Wolverhampton. Now, I had a baptism of fire because 8 weeks into my position, and I led on health protection, we had the swine flu. So I'm hoping for a slightly calmer ride here in Wales. So I'm really glad that the flu's been mentioned already today, and I want to talk about that because it's on my worry list a little bit in a few moments. I was the Director of Public Health in Wolverhampton for nearly 5 years, and in England the system's slightly different, and public health sits within local authorities, which is absolutely fantastic because in order to tackle some of those wider determinants of health, be they housing, which we've just learned an awful lot about, and a whole host of things, being able to work across those communities and functions that councils deliver is really, really important. But I'm now here in Wales at Hywel University Health Board, and I couldn't be more pleased to be your new Director of Public Health. So it's early days, and I've got to plan in terms of how can we improve the public's health here across the 3 county areas over the coming years and decades, because it takes an awful long time to actually make improved health outcomes on the scale that we need to see across Hywel. I want to bring prevention back into the NHS. Now, a national treatment service, needed as it is, isn't going to be able to support that health improvement that we need. We've got to think about prevention and early intervention. And actually, all the speakers I've heard this morning, all they're talking about is actually how can we prevent, or if we can't prevent it, intervene early so we can actually improve health outcomes, or we can actually support a much greater quality of life and hopefully ensure that people, as they become older, actually are able to stay in their homes in an independent way that we so desperately want to see. I was really lucky when I joined Hywel, because I'm sure some of you have seen in a number of different publications they'd already started thinking about population health. I don't know if you've seen that their strategic objectives that they've got. There's 10 of them, and actually 8 of them are all really to do with public health. The first one is around encouraging people to make healthier choices and reduce the number of people engaged in risk-taking behaviour. And what we mean by that is consuming too much alcohol, taking drugs, and sexual risk-taking. We want to reduce the number of people that are overweight or obese across the area. We want to increase survival rates from cancer. We want to improve the early detection and management of people with diabetes, support people with respiratory illness, and I'll come on to that in a little bit because I want to talk about flu before I finish today. Very importantly, we want to improve mental health across the area, mental health and well-being of our local population, because actually you can't have health without good mental health, and actually we focus an awful lot on our physical health and our physical ability, but actually people being well mentally and physically is absolutely essential. And the final one, the 8th one, in terms of those top 10 priorities that are very much to do with public health, is to improve the early detection and care of frail people, particularly those with dementia, which again we've heard about so much already this morning. So I need to come along and try to develop a public health plan. But how are we going to do that across our areas? Well, I'll tell you what, certainly not in isolation. And I might be employed by the Health Board, but my strategic role is really there. It puts me in a great position, really, in terms of how I can work with partners across the whole system to try to make a difference. How can we work together to bring this about? And I see it as a bit of a triangle. So we've got, on one corner of the triangle, we've got statutory agencies, be that the rest of the NHS, local authorities, and I'm really pleased to see elected representatives here today. We mean the education system, social care, the Welsh Government. Another part of the triangle might be our private sector, because it's really, really important that our employers actually try to encourage having a healthy, happy workforce, because often they are not just the productive people within our society, but also they're often carers of the young and often carers of the elderly, and it's truly important that actually they need to look after themselves if they're going to be able to look after others. And the third point of the triangle, which actually is the most important, is around the voluntary and third sector, and that is why I'm so pleased to see so many of you here today despite the weather. And I had a bit of a hairy journey because I came from North Prems and Ceredigion border, and I had to wade through in the car, my little car, quite a few deep puddles, and I was wondering whether I was actually going to get here this morning, but get here I did, and I'm very, very pleased to see a lot of you also braved the bad weather. And right at the heart of that triangle are local people and communities, and that is really where I'm about at the moment. I need to spend some serious time in my first few months and years really listening. I've got to ask the right questions, I know that, and perhaps I need some help from you in terms of what questions do I need to ask local people and communities in terms of really understanding what their needs are and how they might be able to help themselves, whether individually, their families or their communities. So that is my big ask really of you today. How can I have some of those really important conversations with local people and communities that I can actually do the learning that I need to do in order to plan effective, not just services, because actually in this financial climate that we've got, the solutions to everything are not services. The solutions to a lot of things are really good, high quality services. But we need to try to do an awful lot with actually less money. And that is around encouraging people and communities to do more for themselves. And actually, I think listening to others that's spoken this morning, I'm pushing against an open door. I don't think nobody wants to become dependent on services. Actually, we want to remain independent in our homes for as long as possible. but I need to understand actually how I might be able to support that from happening, not just from a social care perspective, but across the whole public health system. And what I mean by that is actually bringing in, whether it's transport, whether it's education, whether it's good high quality housing, actually all of these things, those societal determinants of health, are just as important as people making healthy lifestyle choices, such as whether they smoke or not, whether they drink too much alcohol or not. It's the whole system that I need to be able to learn from you how I can get in there, get stuck in, roll my sleeves up and support local people. I think that later on you're going to be learning about the 5 ways to well-being, and volunteering has been mentioned this morning. Now, I don't want to steal anybody's thunder and going on about the 5 ways to well-being, but actually volunteering and supporting, I suppose, the planning agenda actually will provide you with an awful lot of activities that will probably be able to tick off all of those 5 ways to well-being, connecting, being active, giving, like you can do in volunteering, learning about other things that perhaps you never dreamt that you'd get involved in. And it's a fantastic way to meet new people, but also just keep, I suppose, the old brain really, really going. And I don't think it's ever too late to learn anything at all. And that's why it was so great to hear about the digital schemes. It's really, really important that as you get older, and my mum's 81, she's absolutely terrified of anything to do with a computer. And when my dad died, and he was Mr. Gadget Man, he was, and he used to literally be on the computer or his iPad, and he had a smartphone. Well, when my dad died, my mum just didn't want to access any of that. I've managed to get her with a big button mobile now, so she can actually read some of my texts. And the next thing I plan to do is get her savvy on my dad's iPad. She's a bit nervous about it, but I think it's really, really important to do this safely, and that's why I'm so glad there's going to be a talk later on around actually how can we be secure in doing that. But it brings a whole new world, and that actually from a social isolation perspective, it's really, really important that we stay connected as we go through our maturing years. Now, I said to you I'd talk about my worry list at the moment. So my big job is listening to you around some of that planning that I need to do over the next 6 months to 12 months. But actually, I've got a few things that are the here and now are actually starting to cause me a little bit of concern. One of those is around respiratory health. And I talked about respiratory health in one of our 10 strategic objectives. But actually, too many people are still smoking across our area. And I am concerned that too many people are actually starting to smoke in our area. And what I'd really, really like from you is an understanding of how we might be able to help people make the decision that, do you know what, I'm going to give it a go, I'm going to kick this habit once and for all. But when they do that, how can we get in there quickly with the support services that we need to? So while they're as motivated as they are, actually we can get in there quicker. Now, I'm not going to go into the big e-cig debate today. There's too many things that are unknown about it, to be honest. But one thing we absolutely do know is that smoking is not good for you. And the number of people that we could support in terms of giving up smoking. So I'd really, really like your support on that agenda today. The other thing is around respiratory health, is around flu and influenza. And I'm really, really pleased that flu and the flu jab was mentioned before. We perform really badly across the Hywel area in terms of uptake of flu. And I'm concerned about that. It's not the be-all and end-all. Nothing's perfect. But I firmly believe that vaccination programmes as well as clean water are the 2 most significant and important public health interventions that we have in the Western world. And actually, in those developing countries, if they could have half of what we've got that we actually take for granted, actually we wouldn't be seeing just so much of those horrific scenes that we're seeing, particularly around communicable diseases. So despite that, we have really poor uptake of not just the flu jab. Actually, our immunisation rates of children are also poor. So So that is virtually one of my top things on my worry list. There's loads and loads of things that, and challenges within those strategic objectives that I talked about that are important. They're all important. But actually, as we embark now on our flu season and go through these winter months, I'm really, really concerned that we don't take on board some of those preventative methods that we've got. So the flu jab is a brilliant preventative tool in my toolbox. And I really want to see a lot more people protecting themselves with the flu jab as we move through the winter season. We've just had emerging the news from what's been happening in the Southern Hemisphere. So they have their winter first, and we are very, very fortunate that we actually learn from what's happening in Australia and New Zealand. And they've virtually had one of the worst winters on record in terms of the number of influenza cases and outbreaks. It's really, really been serious. So actually, we need to take that warning very, very seriously. And as we embark upon this flu season, which is going to kick off, literally, if it's not kicking off now in your doctor's surgery, it certainly will over the next couple of weeks. I'd really, really like to see as many of you going for the flu jab yourself. You might be, over 65 in the room, and therefore eligible for the flu jab. You might be under 65, but in a high-risk group. You might be a carer. You might be a carer for an elderly person. You might be a carer for a child, your own child or your grandchild. It's really, really important that you learn to look after yourself so that you can support others over the coming months. So that's the only lecture I wanted to give. If I was going to, the main point of my talk today was about I'm here to listen to you. So I have two asks, and I'll just repeat those. One is about helping me plan for the future. How can we together improve the public's health over the next 10 to 15 years? And from the here and now, how can we together prevent respiratory illness over these winter months by really pushing the influenza jab and supporting really people that want to give up smoking to do that and kick that habit once and for all? My email address is Ros Jervis, and my first name is for Ros. Jervis, Jervis, and I'm at wales.nhs.uk, and I'll make sure that is shared amongst you all. I'd really, really like to hear from you. Thanks very much for listening.